So thanks everybody for coming today. I appreciate the turnout. We have a couple things, Acting Fire Chief Gervais and I have a couple things we wanted to go over related to COVID-19, or as many of us like to call it, coronavirus. First, I want to acknowledge the concerns of residents around this city related to COVID-19. We've received many phone calls, emails, Facebook messages about their concerns, and my family shares them as well. And I want you to know that we are doing everything we can to protect our community, and that we at the city take the health of our community very seriously. And on that, there are no confirmed cases in Idaho at this time, but we're working with city, county, and state agencies on a coordinated response. In fact, just yesterday, the Ada City County Emergency Executive Management Committee, I'm sure that I got the words in the wrong order, met to discuss what we will do together when and if an outbreak occurs. And that agency is made up of elected officials, mayors, county commissioners, and then we had the school districts, the hospitals, the VA, and the Central District Health there with us. And those are the entities that are coordinating closely day by day. And if you'll remember, I think it was Thursday last week, we announced a coronavirus task force ourselves for the city, and that's made up of our emergency management team that works together all the time to come up with contingency planning for providing essential services and for catering to the health and well-being of our citizens in the event of emergency. We've stood up and done drills on other topics year by year in the past, and now this group that has become the COVID task force for the Boise City is working actively daily on mitigation plans for coronavirus. And to that end also, I'm getting briefed daily by the chief and Mallory Wilson, chair of the task force. We will be setting up our PIOs and our communicators department by department beginning tomorrow, so that we can coordinate the communication that we share with residents, because we know it's so important that we update you regularly on what's happening here in the city. And of course, we're working with the state from a state perspective. We've had questions about plans to cancel events. And at this point, we've received no guidance or warnings from Central District Health that would provide me the reason behind issuing cancellation of an event. But I spent time this morning on the phone with state and local leaders around this country and health officials, and everyone's experiencing the same thing, that this is changing rapidly. So I also want you to know that while this is what we're hearing from Central District Health now, we recognize it could change at any time. So we're encouraging all events that are upcoming to be working with Central District Health on ways to protect their attendees, but also contingency plans in the event that confirmed cases arrive here in Idaho and we need to take action. So some things specific to City of Boise buildings like libraries, the airport, et cetera. You'll notice if you come to visit my office or you enter in a library, if you go to the airport, there are hand washing stations with sanitizer out. We're asking people to cover their cough like this, to take basic precautions, and we're doing extra cleaning at the airport, and we'll be doing the same in locations where we provide services to at-risk populations. I'm going to turn my page. We are also coming up with internal policies to address how we provide citizens the essential services needed in the event when and if an outbreak occurs here in the city. And then I talked a little bit about the special events team, or the fact that we don't right now have a health warning or an issuance that would lead me to cancel events. But the special events team that issues the permits is working with those events to make sure that, just as you see in my office and places in the city, that there are hand washing stations, sanitization, is that a word? I'm just going to say the Purell stations, that they're doing contingency planning as well for sick staff and thinking about how to keep everyone healthy that attends events. And with that, I will say that there could be new information this evening, it could be tomorrow, it might be 2 days. I am happy to continually update you as we move forward in the same way that my team is continually updating me on how we're coordinating with state, local, agencies as well as our city staff to keep our public safe. And then with that, Acting Fire Chief, would you be willing to walk through, I've asked Romeo to walk through the work of the task force and how they're addressing the challenges that we have ahead and planning for them.
Yeah, so thank you, Mayor. With the task force creation that was mentioned by the mayor, we've started to put into place a structure to expand our current planning for coronavirus. The city's emergency manager is heading up that task force, and a team of city employees are really working on those preparedness and prevention events. Emergency management is part of the fire department, but coordinates with all of the city departments. The good thing about being in the fire department is we're using similar planning processes that we use for large-scale events, such as floods or wildfires. So we're using that similar planning process to work through the planning for this particular event and really determine what our next steps are. We've committed a number of fire department resources to this who are skilled in those skills, as well as pulling in a number of city staff from the different agencies throughout the city. We're gathering information daily. 2 or 3 meetings just today alone with not just local county, but also adjoining counties, city health districts or county health districts. So numerous information exchanges coming in, coordinating with public information officers throughout the county. And that's one of the key things with this is really coordinating across all those agencies and bringing in the best information from each of those parties that they can provide and then using it to make our informed decisions. So that coordination is a critical element of all this, and our emergency manager is doing a great job of coordinating that. The communications to both our community and our staff remains one of our priorities, and this is an example of that, but we'll continue to communicate as we get new information through all of our methods. And just sharing some of the objectives or the goals, I guess, of that committee. That's probably a pertinent piece. Obviously, our first one is providing for the safety and welfare of our community. Not just the citizens, but also all of our city employees as well. That's a pertinent piece that we're really focusing on as one of our key goals or key objectives of that group. Providing accurate and timely information to all the stakeholders involved. So from our citizens to our mayors and elected officials to our city staff. Those are some key points that really right now, that's one of the key things that we can do is communicate accurate and timely information to all the stakeholders. We're also looking at, as the mayor mentioned, the identification of priority services or essential government services that really need to be maintained from a continuity of operations standpoint. So if something does occur locally and we have to prioritize what city services or looking at what city services need to be maintained, it's not just police and fire. We provide a lot of other services as a city that need to be maintained for our citizens. So really starting to prioritize those, look at what we need to do to maintain those, and continuing to move that forward. And then, as I mentioned before, really maintaining that coordination with local, county, and state agencies, as well as other cities as well. So really, those are our 3 or 4 objectives, if you will, moving forward. And one of the things I would really refer you to is paying attention out there to some of the sites. So coronavirus.idaho.gov is maintained extensively and has current information on the latest information that we have. That's one of the sites that we use. Additional Center for Disease Control as well as Central District Health websites all provide accurate and timely information on this event. So
just to close, I'm just going to do the reminders that I believe that many of us have received by email today, whether it be from employers, from the school district if you have kiddos in school, and that is the more that we can do to keep each other healthy and be personally responsible, the better off we all are as we move through this uncertain time. So as I said before, if you're coughing, please cough in your elbow. Wash your hands. Somebody said yesterday, say the alphabet while you're washing your hands, and do that many times per day. If you're not feeling great, stay home, practice social distancing, and please know that as we get more information, we'll be continuing to share updates, and this is something that will change, and we know it'll change, and we're ready for that, and we'll be back with you again to share any news as it arrives. Thank you very, very much. Yes?
Do you guys have any idea of what level of outbreak would cause you guys to maybe have the city start to have everyone work from home or slow down city services? Kind of what's that threshold for you guys?
Sure. So we'll take all of our guidance from Central District Health and the Centers for Disease Control when it comes to implementing contingency planning. So we know that we have to provide essential services, and our team is working to ensure that we have those plans in place for when and if we get to the point that it's time to have people stay home. And I would expect that you would hear the same thing from other employers, government entities at the same time, because we're looking to Central District Health for guidelines and warnings that would lead us into that next step.
Would you, so Treefort's coming up, you mentioned events, you said that no events are canceled right now. Would the city weigh in on that? The city, significant public resources are used for Treefort. Would they weigh in, and is there criteria on how you might do that?
Sure. So we, not just for Treefort, but there are many significant events occurring in our community. And so we look to Central District Health to provide the health warnings that would then lead us to issue decisions at that point. Right now, nothing has been issued from a health perspective that would lead us to cancel events, but we're telling all events that it's important to have contingency planning and important to be in contact with Central District Health as well, so that as things change, we're all ready to take the next steps.
Anyone else have a question?
I know. Do you have any concerns over, we have both a interim mayor and now an interim fire chief. Do you have any concerns that the people that are currently in those roles haven't always been in those roles? Or just recently came into them?
We have, I'm wondering if you'd like to rephrase that question.
I guess just something I've heard from readers is there is concern that both the fire chief and the police chief are both relatively new into those positions. Is there any concern that that might change anything?
That's what I thought you were asking, but I just wanted to make sure. Acting Chief Gervais is deputy chief and has been involved with our emergency planning for quite a while. Acting Police Chief Masterson was our police chief and again was very involved in the original setup of our emergency management team. We have a great team of folks that just this summer, I myself was part of the practicing day in August where people go through what we do when and if there's a public health emergency or any type of emergency in this community. Those groups are set up and ready to roll. That's what's made up the task force. And then, of course, we will be setting up incident command with our communications officers. So this city is prepared to go at the time that it's necessary to go. And I should say we're already going in terms of announcing, I guess I shouldn't say announcing. We're already going in terms of pulling everybody together and working throughout the day, every day, on what's next. And it's not just the city. It's so important to remember as residents throughout this city and state that the website shared is a state website, coronavirus.idaho.gov. Central District Health, both locally and statewide, are working with the risk manager in the governor's office. We have our own emergency manager, Mallory Wilson, and then, of course, the acting chief, and other members of the task force that are communicating daily with health, city, county, and state officials on this issue, as well as federal officials, frankly.
If somebody suspects that they have the virus, what is the process that they should go through that you guys suggest that they should do?
So, I am not a medical doctor, and I don't want to say the wrong thing on Facebook
Live. Is there a hospital that you guys have set up that somebody should maybe go to instead of going to some random, primary care facility?
I'd go to coronavirus.idaho.gov and the Central District Health sites for that information if you're suspecting that you're sick. But even if you're not suspecting that you have coronavirus, but you are not feeling well, it's flu season. And I think we're all learning through this how important it is, if you're sick, stay home so that other people don't get sick. Please.
Are we good? I just have one. Okay. There's been some concerns about the lack of availability for tests for COVID-19. Do you guys have any plans or have you guys talked at all about maybe putting in city resources to pay for more tests for more people?
We are looking to Central District Health to determine how many tests there are and where they're going. That is not something that the city itself gets involved in terms of numbers and just distribution. The health elements of this are really tied to Central District Health and medical care providers.
Yeah, and I might add from our briefing yesterday that the number and availability of the test and the turnaround times of the test has improved rather substantially. The Idaho labs can now do some of those tests we were briefed on yesterday. So the availability and at least the turnaround times, they were saying 24 to 48 hours now. So we're getting information back certainly quicker, and as they continue to evolve, I'm sure additional tests and things like that will become available. But that's certainly something that Central District Health and our partners are aware of.
Great, thank you. I have a city council meeting in just a couple of minutes, so I need to get ready to pivot to that. And I believe that part of that agenda is a presentation from Mallory to the council on the readiness, what's the word?
Plan.
Preparedness. The preparedness and the plan that's been developed. So you're welcome to stay for that. Thank you all very much.
We're here to help you with any additional questions.